Hi, everyone. Welcome to our virtual AAPOR talk. My name is Jonathan Robinson, and I'm here to present a joint project with my co-authors, Chris Warshaw at George Washington University and John Sides at Vanderbilt. And today we're going to talk about trying to answer this question, which is why do ballot measure outcomes differ from issue polling estimates, survey experiments, and status quo biases and issue preferences. So let me go full screen. This may sound like a familiar topic. If you attended the virtual meeting last year, you'll know that me and this same group of colleagues gave a talk where we tried to talk about sort of the first part of this question, which is sort of this puzzle that we came upon, which is that when we examined historical state level polling estimates of issue opinion and compared them to the results from ballot initiatives, for which we were able to do about 200 or so, we found that there was an important gap. The correlation between the two measures is somewhere around 0.6. But there are these interesting patterns in how the two measures of issue opinion really, ballot initiative outcomes, electoral votes by people in real elections about specific public policy issues, and what survey-based estimates of public opinion had to say. And this graph is sort of our major takeaway. So on the x-axis is issue opinion from polling data based on a dynamic MRP model that Chris developed with his co-author Devin Coey for an important book project that he's currently working on. And then the y-axis is just the absolute difference between the ballot initiative outcome and what the survey data suggests issue opinion should be on that specific issue when we match up these various issues. And this shows sort of an interesting trend, which is that the largest errors, the largest discrepancies between the ballot initiative outcomes and survey-based estimates tend to come from issue opinion on particular issues that are sort of in the extremes, sort of things that are very popular in either in the conservative or liberal direction. So for example, in the very liberal direction, we have initiatives on background checks for guns, which tend to underperform quite a bit, but are very popular in survey data. And on the left, in the sort of less popular liberal position, more popular conservative position, we have public policy proposals like parental consent for abortion, which generally speaking in polling data are quite popular, but as we can see, tend to underperform quite a bit when they get proposed at the ballot box. So at that time, we had sort of a idea, but without very much strong evidence, that the reason this was the case was because of status quo bias, or just a bias towards no when initiatives are opposed on the ballot. Generally speaking, voting yes is to change public policy from the status quo to some new status quo, to update that. And we felt, our hypothesis was that the status quo bias was very important, but it was very difficult with the observational data that we have to sort of credibly make that claim. So as a result of that work and extending it and putting together a more coherent research project, we really wanted to understand this question, which is just how much of the difference between the issue polling estimates and the ballot initiative outcomes is due to status quo bias. And today we investigated that using two sets of survey experiments that we piloted and collected and collaborated on from in 2020 and 2022. So the first set of projects is actually a set of survey experiments that were conducted by Data for Progress, which were shared with us when we were talking with other researchers and interested partners about the work that we had done. So in the summer of 2020, they ran a set of survey experiments on two separate issues around government-run healthcare programs like Medicare for All proposals and paid family leave. And they had sort of an interesting design that was that sort of gave about 4 versions or treatments of questions about these issues. One was sort of in how the survey question was framed, whether it was sort of a standard support, oppose, sort of Likert-based sort of situation. Another one that was sort of a binary framing of various choices that voters had on an issue. And then they also varied whether they specifically were framing the issue as being about changing the status quo or not mentioning it really at all. And so here's sort of an example of one of the questions on sort of a Medicare for All government-run healthcare program. And so in the support or oppose reform frame, you can see that the top left quadrant over here with no status quo framing is sort of a very straightforward issue question framing of this issue. And then when you look at the status quo framing, it just explicitly primes people to think about changing from the current system to a government-run healthcare system that provided all Americans with health insurance. And then in the binary choice or choosing between reform and alternative, we can see sort of in the status quo frame that it's specifically about which of these following approaches to healthcare in the US would you prefer. There's one that's about replacing the current healthcare system versus maintaining the current system. So, this is an example. And again, this was a very similar version of this that was run for paid family leave as well, which we'll show here as well. But so just to look at these results, the binary choice is here on the left, and we can see that the differences here in the various line plots are showing treatment effects in terms of changes from no status quo framing to status quo framing. We can see that in the binary choice world, there's very little difference, but in the support oppose framework, there's actually quite a large difference. Priming the status quo in the support oppose instance decreases support for government-run healthcare programs like Medicare for All by about 9 points, mostly coming from people going from don't know or from support to don't know. We see sort of a similar trend. If anything, the sort of status quo frame for the binary outcome modestly increases support for paid versus mandated family leave versus voluntary leave in terms of paid family leave policies. But when we look at the support oppose framework, it's a very similar 8-point decline to what we see, the 9-point decline for the healthcare programs. And it sort of comes equally from don't know and opposition, gaining from that decline. So, we thought that these set of survey experiments were really promising. And we wanted to work on our own to build on this work and bring in some applications from the issues that we actually had worked on this particular project. So in 2022, literally this past month, we finished fielding a set of survey experiments with data for progress that we helped design to test status quo bias on policies in our referenda data set that we designed specifically to mirror the initiative voting experience. So there's no don't know option. Voters are allowed to skip particular items without giving a response, just like they are able to roll off the ballot in the ballot initiative voting context. As a result, we have about 6,000 survey responses with item variable missingness from people not answering specific sets of questions. And we looked at 4 public policy items that we specifically chose from the ballot initiative data set. We looked at Medicaid expansion, parental consent for abortion, background checks for gun purchases, marijuana legalization. And we had sort of 3 conditions, 2 that are very similar to the previous test, baseline standard issue question wording, a second one that primed status quo in the question wording, and a third one that we modeled off of various ballot initiatives on these various topics. So just to give you sort of a sense, so this is an example of the output of our analysis of a Medicaid expansion set of experiment that we ran in this particular arm, sort of one of these 4 public policies that we tested. And so on the right here is this regression output that controls for various demographics and compares baseline differences from the just no status quo standard issue question to one that primed this change in the status quo and one that was ballot language. And we can see that for Medicaid expansion, there's a slight decline, though it's not statistically significant relative to the control status quo, and that the ballot language treatment decreases support for Medicaid expansion by quite a bit. As you can see here, it includes actually a fiscal impact statement, which is part of the challenge of making these kind of comparisons between ballot initiative language and survey wording, which doesn't really go into that depth. But we can see here that generally speaking, they're really this status quo frame did not work in this first experiment. But however, it does work in other contexts. So in parental notification consent for abortion or parental notification policies, we see that framing the status quo, emphasizing the status quo and framing, and the ballot language treatment both drop support for these public policies. This change in the status quo by about 6 or 7 points, and both in the similar direction, to the extent that we think that in this case, this status quo change frame maps on to what we see in that ballot initiative wording, very similar to what we see with background checks. Again, somewhere in the 6-7 point drop range, very similar across conditions. And then we sort of weirdly see the opposite for marijuana legalization, where both the status quo frame and the ballot language frame actually increased support for legalization, which goes in the opposite direction of what we'd expect. But it does so in both cases, which is something we're still trying to understand. Curious if people are interested in emailing or following up about reasons why they think this might be the case, but it sort of goes in the opposite direction of what we would expect. So I think across these 6 survey experiments that we examined, we see that relatively speaking, status quo bias likely explains some, but not all of the difference between ballot initiative outcomes and issue opinion top lines. It's not always in the predicted direction, or in some cases it's null in the case of the Medicaid expansion, but across 4 of those 6 issues that we tested, Medicare for all, paid family leave, parental consent for abortion, and background checks for gun purchases, we see that this does go in the predicted direction of our theory. Unfortunately, other explanations for this discrepancy are harder to test in a design setting, but the gap does seem to be caused by more than just the status quo bias in our formulation of this testing. And we're interested in looking in more observational data that we can merge with the ballot initiatives to see if we can suss this out even more. Sort of one other takeaway is just that the treatment effects that we see both for the ballot initiative language and the status quo frame are, I think, relatively large in terms of survey experimental manipulations, but don't nearly explain, the 30 or 20 point drops that we see, or even sort of some of the smaller ones that we see in the 5 to sort of the 10 point-ish range. We don't really see that in this setting. So there's sort of clearly a difference in how much you're able to move a voter in a survey experiment versus the real world. And so it's a little bit difficult maybe to triangulate how much the difference is going on here, how much we should expect from these kind of simple survey manipulations. We're really, really excited. We really would love to get questions, whether it's on Twitter. My handle's at John_M_Rob. Very happy to answer any and get any feedback. And if folks want to reach out to us, here are our various emails. So thank you very much, and look forward to seeing you all at AAPOR sometime soon. Bye-bye.